Good afternoon. Hi, and thanks for having me back today on 1623. I'm glad to be here to give you an update from when we spoke last week. We were seeing an uptick in our community of new cases. So I wanted to give you an update on that, first of all. As of last night, we have 75 active cases here in the city. However, we've seen our numbers of new cases associated with our initial outbreak decline each day through the week last week. About 20 of the 75 active cases are newly tested folks at our drive-through testing site, which we would expect that we would uncover a number of positives who are mostly asymptomatic and didn't, but came to the drive-through testing site that is available for anyone even without symptoms. So we did pick up 20, and that is a little bit less than a 2% positivity rate. And that's about where the city was sitting a week ago. So this is very, very encouraging to us that we did a mass surveillance testing. We tested over approximately 1,200 people in the 2 days. We'll be testing a bunch more this week. And we've not seen the percentage of tests positive come back any higher than that 2% rate. So I hope that's clear, because I think it's a very reassuring sign for the community that, that there isn't a wider outbreak at play or an exponential growth happening here, or we would have seen that in our positivity rate. We would also expect to see it in our BioBot testing, which is the wastewater treatment testing that we do once a week. We did see an uptick last week from the week before. We expected that because of our small outbreak here in the community. But again, we saw it proportional to the number of cases we had, not such a high spike that led us to worry there's a lot more cases to come. It's not an exact science, so we'll really cautiously watch this week's numbers as well, because the BioBot, again, it's testing the whole population in general, so it isn't going to directly correlate to a case number, but it can give us a good indication, which is what we hoped it would do, and I feel like so far it has done that. So we're cautiously optimistic and watching these numbers. We have not seen any more transmission occurring in our schools, in our nursing homes, in our long-term care facilities, or our high-risk senior housing. These are the areas that we're watching the closest and most concerned about, and we are not seeing any of those signs. We've, as of last week, had no ambulance transports for COVID-like symptoms, and there are no hospitalizations here on Cape Ann for COVID. It's not to say we should let down our guard. This is a contagious disease. We are coming into the winter months with flu, and this is the time period that we were worried about, and we anticipate that case numbers will rise. But we are seeing some encouraging signs that we are containing it. I also want to give a shout out to everyone who has been asked to quarantine by our nurse contact tracers. It's really hard because sometimes you feel fine and you want to go to work or school or send your kids to school. But we know that this is how the virus spreads. And in order to stop that spread in our community, we need people to take this advice seriously. And when you are told by a public health nurse that you are a close contact of someone with COVID, you need to take that seriously and realize that you are at a greater risk over the next 14 days of developing COVID yourself and becoming positive. So it's really, really important that people do quarantine, even if they test negative during their 14-day period. You still need to quarantine the full 14 days because that's how long it can take for the virus to appear or to develop. So we will be pushing out as many resources as we can that are available to families, to people for if they have to take time off from work, if they need assistance, support financially. We're going to try to get together as many of those resources as we can and push that out through the mayor's office and our other outlets so people have that information. Again, quarantine is different from isolating. Isolating is when you have the virus and you're sick and you need to be totally kept separate from everyone else. You're contagious. Quarantining is when you've been identified as a close contact and you need to stay separate from the public and stay basically home for 2 weeks. I think those are the main things. I wanted to share the phone number if anyone goes for testing, and I encourage you to go over to Stageport Park and you can get yourself, have a COVID test. It's a simple around the tip of the nose swab, so it's not the deeper nose swab. And people are getting results from our partner company, Fallon Ambulance is getting those results in 1 to 2 days for most people. So we encourage you to take advantage of the testing here in town. And I provided the phone number and email. You'll get an email from them with your test result or a text. And I've shared that email address, and we're also putting it up on our website. And then there's a phone number to call too. If you don't get an email and you haven't heard, then you can call in their call bank and get your results.
Karin, is there any chance that there'll be more dates added after this week?
There's always a chance. It will be a response to how we're doing. The state will approve days a chunk at a time, and we can always ask for more if we feel we need it. So we're kind of watching to see how this week goes, and then we'll make decisions. There's always sort of specific testing programs for some of our high risk establishment sectors as well. For example, long-term care facilities. They have their own programs through the state. Schools, if they have any cases and they reach certain thresholds, they have their own programs. So there's always those programs that we can and do pull in as needed. But then the general sort of mass surveillance testing for asymptomatic people like we've been doing. Yeah, I mean, I imagine we'll probably do it again this year, but I think it just depends on how our numbers go and what we feel the need is.
My one comment, Karin, is apparently someone called into our station concerns that people on the boulevard were not wearing masks. Do you have a message for them?
Wear your mask, wear your face covering. Yeah, that's our message. Wear your face covering. Anyone who can, anyone, but as we've said all along, there are some people that can't or won't. And really, let's focus on what we all can do as individuals and just continuing to educate that this virus doesn't really care who you are, what walk of life. It's a virus, and we know now there is enough research out there that we can feel really confident that a simple double layer of cloth can prevent enough exposure to get you sick in most cases. So again, that's the facts. I mean, I rode through Gloucester on Sunday morning, and there were a lot of people walking and sitting, and I was amazed how many people did have their face coverings on. I was so proud. People walking, people talking, and not necessarily super close either, but it's just become very much the norm, I think, for most of us when we go out and about. So yeah.
Well, we appreciate you sharing time with us. Again, we know that there's a ton going on and things are moving very rapidly here. So we really appreciate it. And then, I don't know, maybe a week or so again, we do it all over again.
Sure, we can do a quick update. I mean, that really helps us in the health department get the message out to people too efficiently. So we thank you for the time and helping us get our messages out and letting people know what's really happening, because there is a lot happening and it's changing quickly. So we want to find as many ways as we can to share this information so people really understand and can make their own decisions about being out and about.